Good morning and good afternoon, good evening, everyone. My name is Abdam Ofkadu. I'm the nutrition lead for USAID Momentum and Country Global Leadership. Welcome to today's webinar on opportunities for integrated climate and nutrition action. Next slide, please. We are thrilled to be discussing our newly launched landscape analysis on national climate, health and nutrition policies, strategies, and plans in eight countries. We are dropping the link to the report in the chat, so you can also access it using the QR code. Next slide, please. This climate nutrition work has been an exciting part of Momentum Country Global Leadership work to strengthen countries' technical capacity and systems to understand ongoing obstacles, design contextualized solutions to integrate nutrition into maternal, newborn, and child health service and quality of care. And this is the agenda for today's webinar. We'll start with opening remark from Momentum Country Global Leadership, as well as USAID, and Rachel Taylor will present the landscape analysis of finding and recommendations, and we'll also from Malawi Ministry of Health reflection from the countries. We'll have also a question and answer session. We'll be accepting questions via the Zoom question answer box, and please share your question and comments in the Q&A box. We'll have time at the end for question and answers. Now it's my pleasure to invite Koki, Project Director of Momentum Country Global Leadership, to deliver a welcoming address and introduce Dr. Patrick Webb from USAID. Koki.
Thank you, Haptamu. I really appreciate that we have an opportunity to discuss such an important topic. Climate change poses profound challenges to health and nutrition security, particularly for women and children, who are among the most vulnerable to its impact. According to WHO, climate change is projected to cause about 250,000 additional deaths annually between 2030 and 2050 due to malnutrition, malaria, diarrhea, and heat stress. And the UNICEF Children's Climate Risk Index highlights that 1 billion children are at extremely high risk of climate change impacts, underscoring that climate change is one of the greatest threats to our world's children. The climate crisis is also a nutrition crisis. Today, about 45 million children under the age of 5 suffer from wasting, the most life-threatening form of child malnutrition. Alarmingly, the majority of these children are also living in countries that are highly susceptible to climate shocks. To address these interconnected challenges, it is critical that we adopt integrated approaches that link climate change, health, and nutrition. Such efforts can improve health outcomes, enhance survival rates, and prevent malnutrition. So our project Momentum Country and Global Leadership, which is funded by USAID, works in over 25 countries in partnership with governments, local partners, and national and global stakeholders to accelerate progress around maternal, newborn, child health, and reproductive health services. And as Haptamu mentioned, our project has conducted a review of opportunities for integrated climate and nutrition action at the national policy level across 8 countries, which will be shared and discussed during today's webinar. Additionally, we have developed a thought paper on climate change and sexual and reproductive health, which is shaping our programming and work. Our Momentum Country and Global Leadership India Yash project, for example, is actively generating evidence, raising awareness, and designing implementation models on the intersection of climate change and sexual and reproductive health. Country leadership will be key to bringing about this coordinated action and multi-sectoral initiative that can address the interdependent drivers of climate change, nutrition, and health. We are hopeful that today sparks a conversation and a dialogue on this vital issue and ideas on opportunities for climate, health, and nutrition integration into your country work. I encourage everyone to openly share the knowledge that your expertise and your experience for a rich learning experience for all of us. And now it's my pleasure, and indeed I'm thrilled to introduce our first speaker, Dr. Patrick Webb. Dr. Webb is USAID's chief nutritionist and one of the world's most influential voices, working at the intersection of food policy, climate change and nutrition, as well as on emergency humanitarian assistance. Dr. Webb has authored over 200 peer-reviewed journal articles, as well as multiple books and chapters, and his research has involved humanitarian policy and practice, development policy, micronutrient deficiency, food system transformation, food safety and nutrition in all its forms. He has led the USAID review of food aid quality from 2009 to 2021 and has been the director for Feed the Future's Nutrition Innovation Lab and the subsequent Feed the Future Food Systems for Nutrition Innovation Lab. From 2003 to 2005, he was the chief nutrition for United Nations World Food Program. In addition to many other illustrious positions, it is indeed our honor to welcome Dr. Webb. Over to you.
Thank you, Koki, for that warm introduction. Actually, the pleasure is mine, and I want to thank the MCGL team for inviting me here today to talk about what is a really important report, supported in part by USAID. So, as several people already, Koki and Haptamu have said, climate is now squarely a nutrition concern. It's at the nexus of food systems and health systems. I'm asked as chief nutritionist of USAID to give lots of talks in my capacity, and by far, so far, the most common request has been to talk about climate and nutrition linkages. So the demand for information and insight is there, but we have to quickly move on from talking about this intersection to doing something about this. Climate change is undermining our goal of achieving a well-nourished population globally. It's stressing the systems that families rely on for good nutrition, including the food systems that allow for access to safe, nutritious food, and the healthcare service delivery systems as well, let alone other kinds of economic and social protection systems. In other words, the climate crisis, as Koki just mentioned, is also a nutrition crisis and vice versa. And the two are interlinked as planetary challenges of the day that can only be addressed simultaneously. Lots of negative projections. The nutrition impacts of climate change, we know, are most severe, for those least equipped to adapt to it. And there's a recent analysis from West Africa that suggests that a 2 degrees centigrade increase in temperature across West Africa by 2050 would result in a more than a 7 percentage point increase in stunting and an additional 590 million people undernourished globally. This is catastrophic, and if this happens, it reverses hard-won gains of the last decade. So we urgently need solutions that encompass integrated multi-win dimensions, which is at the core of this report. 2 years ago at COP27, there was recognition of the need to do better by the global community in integrating climate, food systems, and some nutrition actions to accelerate progress for all, but progress is far, far, far too slow. We need to act faster to fix our food systems so that they contribute less to greenhouse gas emissions and find ways to mitigate climate change impacts on food systems, health systems, and ultimately on nutrition. And that then means we need to build capacity of health systems to be efficient and responsive for service delivery, for example, during times of shocks and stresses, just as we have to build the resilience of food systems. So the path forward for ensuring sustainability and resilience of both health and food systems, one of the keys is strengthening policy environments that wrap around these systems. And we'll hear a bit of this from the case in Malawi. Hence the critical importance of the word integration, integrating food systems, health systems, and nutrition as a core part of climate policies and investments. At USAID, this focus on robust policies is really important for the countries in which we work, where the missions around the world support national governments and local governments. Stronger nutrition programming is a result of important policies, strategies, action plans like NAPs, National Adaptation Plans, that strengthen the enabling environment for action on the ground. So USAID supports partners through efforts like the Comprehensive Action for Climate Change Initiative, CACI, which supports governments to strengthen and implement nationally determined contributions, the NDCs, and national adaptation plans, for example. And CACI does include a focus on health and food systems. And there's support for areas such as developing health national adaptation plans, HNAPs, and advancing policies to reduce food loss and waste and build resilience of food systems. In terms of other opportunities, some of you will be aware that USAID's 10-year multi-sector nutrition strategy, which addresses the direct and underlying causes of nutrition, is coming to an end next year, at the end of 2025. We're now working on a refreshed, probably 10-year strategy, and we will be challenging ourselves to consider what is the new evidence emerging on the climate nutrition nexus as we develop out this new strategy. In closing, I just want to mention that USAID is working together with the governments of France and Japan in an intergovernmental troika, if you like, to help organize the March 2025 Nutrition for Growth Summit. That event in Paris will be a powerful demonstration of global commitment to end malnutrition in all its forms. And climate is one of the 6 key thematic areas for that gathering. And during the summit, we expect countries to come forward with robust policy and financial commitments towards this important goal. National countries, not just donor countries and partners, also private sector. Let me just mention that at the last Nutrition for Growth Summit in 2021, the nations that attended mobilized over $27 billion through almost 400 registered commitments across 78 countries. Of that 27, the US government alone announced the intention to spend $11 billion over 3 years to support nutrition investments. In fact, we exceeded that by more than 1 billion, which is great, but it's still not enough. We need to seize moments like Nutrition for Growth to make meaningful progress towards ending malnutrition. And that means embedding nutrition in climate change agendas and vice versa, climate change in nutrition agendas. We need strong evidence. We need effective and innovative policies that are based on as much evidence and programmatic experience as possible. So thank you, Momentum, for this review, the excellent report, which I have read. I hope everyone reads it in depth. And thank you again, MCGL, for the invitation to be with you here today. And we look forward to discussing the findings and finding ways to implement recommendations. With that, thanks, Haptamu, and back over to you.
Thank you, Dr. Weber, really for sharing, USAID, commitment, USAID policy directions. Also, it's exciting to hear climate will be down of the area for Nutrition for Growth Summit in Paris. Thank you very much. Now, I'm delighted to introduce my colleague, Rachel Taylor. Rachel is a senior global health advisor with Save the Children US, bringing 25 years of experience. She provides technical assistance for the design and implementation of programs at the intersection of climate change, health, equity, and system strengthening. In addition to the MCGL climate nutrition activity that she will be presenting shortly, Rachel currently supports the Green Climate Fund's first ever health award in Laos. Now I invite Rachel to present the finding of the review. Rachel, over to you.
Thank you so much, Haptamu and Patrick and Koki, for your opening remarks. Before I dive into the findings of our activity, I want to say a quick word of acknowledgement and thank you to Marjolein Smit-Wanamwenge, who is a nutritionist and whom we engaged as a consultant to support this desk review. Mariline was an excellent partner and technical colleague, and if she's on the line, I just wanted to make sure that you heard me say your name and thank you and acknowledge you to everyone. Next slide. Okay, and actually, next slide, please. Okay, well, I feel that between Patrick and Koki, the job has been done to set the stage for all of us in terms of the broader context of the challenges at the nexus of climate and nutrition. So I'll just restate for this particular Momentum Country and Global Leadership, or MCGL activity, our focus was really looking at understanding the policy landscape at a national level across 8 countries to identify which frameworks, plans, strategies already do or hold the potential to strengthen the enabling environment for integrated multi-sectoral action on climate and nutrition together, which is critical, as Patrick has mentioned. Next slide. So just a quick word about the nuts and bolts behind this effort. This was a global desk-based review of policies from 8 of USAID's 14 nutrition priority countries. You can see them listed here on the slide: Bangladesh, Ethiopia, Ghana, Malawi, Nepal, Nigeria, Tanzania, and Uganda. It's important to note that this was a desk review. There were no interviews, no sourcing of local documents from country level. This was purely on the basis of recent policies in the last 5 to 10 years that were published in English, publicly available online, and which ultimately fell roughly into the 2 categories you see listed on this slide. Climate frameworks and policies on the one hand, which I will explain in a subsequent slide, and which I think Patrick has alluded to, as well as health, nutrition, and food systems plans and policies on the other hand. And given the diversity of sort of the nature and the types of these documents, we used a wide variety of search terms to identify where there are those opportunities, or where there are already actions on climate within health and nutrition policies, and then vice versa, where there is or could be action on health, nutrition within climate policies. Okay, and I think one more word of acknowledgement as well. Patrick mentioned COP27, and I would like to share that the work, when we were designing this activity, I think the middle of last year originally, as we were just putting the finishing touches on the design, we learned that the Initiative on Climate Action and Nutrition, or ICAN for short, which was started out of COP27, we're undertaking some related reviews and baseline analyses. But there were important distinctions between our work, and throughout ICAN colleagues, particularly colleagues from GAIN, WHO, FAO, and others, were hugely supportive and helpful to this effort. Okay, so let's dive in. Next slide. All right, and next slide again, please. So as I mentioned, I would say a few words about each of the key climate frameworks that we included, because they may not be as familiar to some of you in the audience if you're coming more from a career in the world of reproductive, maternal, child health and nutrition. So first, we have nationally determined contributions, which are, as the slide describes, the heart of the Paris Agreement. These are submitted every 5 years to the UN FCCC, and they are expected with each successive round to be more ambitious, to have higher and harder targets. The third round of these NDCs are due actually in early 2025. And so in addition to them, describing targets for greenhouse gas emission reduction targets, sequestration, NDCs also enable countries to mobilize resources, engage stakeholders, and integrate climate considerations into their broader development planning processes. So NDCs are very important for all of us in the health and nutrition community to be aware of. Next slide. So here are a handful of findings. I won't even say illustrative because we have many different and kind of diverse findings across the NDCs. And I will again direct you to the report and the brief for more details. But what I'd like to highlight here is that, the big takeaway is, well, nutrition doesn't feature prominently in this last round of NDCs, but there are exceptions, and those exceptions are really instructive and give some good examples for others to consider and to potentially follow. So first of all 8 countries do have NDCs. The 3 that reference nutrition are Bangladesh, Nigeria, and Malawi. Bangladesh mentions that it prepared its NDC in line with national principles related to enhancing economic growth, achieving food security and nutrition security for all citizens. Nigeria's NDC refers to the potential role for nature-based solutions to both conserve biodiversity while also enhancing food security and increasing the availability of nutritious food necessary to address Nigeria's high rates of child malnutrition. And then Malawi is a fantastic example, and so not coincidentally is why we have a speaker from Malawi following me. The NDC for Malawi really connects climate and nutrition with distinct plans to act. And I won't go into detail because I think that our colleague will probably speak to this, but just to say that their NDC specifies the promotion of nutrition-specific practices, through care group models, scaling up nutrition framework, primary health care, therapeutic care, and the point of contact for nutrition within the NDC is the very office of our speaker who will come next. And then finally, most NDCs do include some health measures, which is a good thing because that presents opportunities for us to integrate nutrition, such as the example that Tanzania provides. Next slide. All right, a brief word on National Adaptation Plans, or NAPs for short, and I think colleagues can drop a link into the chat where you can find more information. In short, these describe how countries can reduce their vulnerability to the impacts of climate change by building adaptive capacity and resilience, and how they can do so in a coherent manner across sectors and policies and systems. Next slide. So here are, again, just a few examples of really promising opportunities in a handful of these NAPs. In this case, from Bangladesh, Ethiopia, and Nepal. Bangladesh does a great job recognizing that women are disproportionately affected by the adverse effects of climate variability and change, and they reference the compounding effect of extreme weather events on food shortages and on the potential for nutrition challenges during pregnancy. There are nutrition sensitive actions within Ethiopia's NAP, which you can see summarized here. And Nepal's NAP highlights the impact of a host of climate hazards and shocks on nutrition-related disease, as well as other health concerns, illnesses, and mental illness. And importantly, I just wanted to flag, Patrick mentioned HNAPs as well. Nepal did develop an HNAP, and other countries are doing so. This is a stellar and invaluable means to strengthen a country's overall plan to adapt to climate change when it comes to health. So I strongly encourage you to check out available HNAPs. We'll share a link for that as well, and to consider incorporating those in your country policy landscape. Next slide. All right, brief word on climate and health vulnerability and adaptation assessments, or VNAs for short. These are sort of a prerequisite to developing an HNAP. And if you'll go to the next slide, these are important because they help us understand which populations and geographies within a country are most vulnerable, and what is the capacity or lack thereof of health systems to anticipate, prepare for, and manage the impacts of climate change on health. And here, sorry, I was on the wrong slide. Here are some selected findings from Ethiopia, Nigeria, and Tanzania. In the interest of time, I'll just note that maybe the one challenge or the one gap in the VNAs that we reviewed, which not all of them are publicly available, the ones that we reviewed didn't necessarily, there's more that they could have done to incorporate malnutrition specifically into their assessment. And there are tools and resources to support conducting thematic vulnerability and adaptation studies on malnutrition within a broader VNA. And that's important and helpful. Next slide. Okay, and sorry to rush, there's so much to cover. A few minutes on our findings and then move on to recommendations. Next slide, please. Okay, so as you know, I first talked about nutrition and health within climate frameworks. Now we're going to do the reverse. And first, just to mention that the national health sector plans that we reviewed, again, across these eight countries, I mean, they all consider climate change a threat for the most part. And one place where we see significant opportunity to integrate nutrition more strongly is in efforts to increase the preparedness capacity of governments for the effects of climate change more broadly. So, for example, Nigeria, through its National Health Sector Plan, is seeking to ensure that there's a strong public health emergency management and surveillance system that is well-equipped, committed, and versed in climate change issues and their consequences on health. This is huge, and it offers a sort of a real opportunity to include nutrition therein. Climate and nutrition together therein. Nigeria's plan also promotes public health education on the impacts of climate change on health and seeks to build capacity of healthcare workers to address these impacts. Finally, I'll skip over the two middle. They're very important, but just to note that Uganda, if you go down to that last bullet, notably has developed guidelines for local government planning processes that encourage, at a district level, districts to mainstream climate change activities in all of their health planning, budgeting, implementation, et cetera. And so, you know, while our work necessarily was done at a global level, looking at national policies, I'd like to call out this example from Uganda. Next slide. Unsurprisingly, climate shows up throughout national nutrition plans, multi-sectoral nutrition plans, to differing degrees, though. Bangladesh makes a direct and clear link between the need to scale up nutrition and health services in the areas most prone to climate disaster, climate hazards, which is something that's critical, as Patrick mentioned earlier. Malawi spells out the need for specific targeted nutrition interventions for vulnerable groups in order to safeguard them from undernutrition resulting from floods, droughts, or disease outbreak. And you can see some other examples here. Next slide, please. I won't dwell on this, not because it's unimportant, but because we're close on time, but just to encourage you to look at this section of our report as well, which gets a little bit less attention, but is important. Next slide, please. Okay, so on the basis of this rapid review of some of our findings, what do we recommend? We have three overarching recommendations. And if you can go to the next slide. The first one, which is very broad, is really to encourage the explicit integration of climate, health, and nutrition actions in both directions across all frameworks and policies. And in particular, we think that nutrition must be integrated into nationally determined contributions. NAP processes are underway in many countries, and we would advocate for health NAPs in particular to be developed. And then to support the development of both, ensuring the inclusion of thematic vulnerability and adaptation assessments on nutrition. And here you can see some of sort of the time-bound opportunities that are in front of us, particularly around NDCs, which again are due to be submitted early next year. And so the time is maybe still right to try to incorporate nutrition there. I don't think the window has closed in many countries on those. Next slide, please. So then the flip side of this is incorporating climate into national health and nutrition policies and plans. What I'll highlight here, and nutrition colleagues will know much more than I do, but you know, it's notable, and it feels like it's right in front of our hands. Importantly, that so many national nutrition plans are, you know, imminently or in the near future due to be revised and updated. So For any of these 8 countries that we reviewed, and perhaps many others, this is a really golden opportunity to incorporate climate into national nutrition plans, even more strongly than they may already appear. Next slide. Our second recommendation also reflects something that Patrick shared earlier about multi-sectoral collaboration, and really gets at, and which is an enabler for the first recommendation, I think, to be successful. We need to strengthen our ability as health and nutrition stakeholders, strengthen our ability to understand and to be somewhat conversant in. We don't have to be fluent in climate science, but to be conversant in the ways in which human activity, climate change, health, and nutrition are interconnected and how they act upon one another. And we need that so that we can be effective in amplifying health and nutrition priorities, and really critically important, as Patrick also mentioned, to make the case for climate financing. Climate financing for health, inclusive of nutrition, is absolutely critical. Next slide. And then finally, our third recommendation is also a bit of an enabler or facilitator. This is really a recognition of the importance, raising the importance and understanding of the climate and nutrition nexus more broadly, and in particular within important global fora that are underway right now, COP29, or coming up soon, including the summit in France in March that Patrick has mentioned. Okay, finally, last slide. I will close with a reminder to all of us that across these frameworks, plans, and indeed our own recommendations, gender and other social determinants that drive differential impacts of climate change on nutrition and health must be recognized and prioritized. So with that, I will say thank you very much for the time to present, and switch hats now to introduce our next speaker. And to help us get out of the global clouds, as it were, and onto solid ground. I'm honored to welcome Mr. Kondwani Mpeniwawa, I apologize, Mpeniwawa, who is the Deputy Director for Nutrition in Malawi's Ministry of Health. As Deputy Director, he coordinates and oversees the development, review, and implementation of Malawi's multi-sectoral nutrition policy, a role that allows him to integrate nutrition into different domains, including climate change and food systems. He has a wide-based professional and technical background and holds a Master of Science degree in Applied Human Nutrition from the University of Nairobi. Mpeniwawa, over to you, sir.
Thank you, Lakia, for the introduction. And let me take this opportunity to thank the MCGL for inviting me to speak on what Malawi is doing on nutrition and climate change. I should start by saying that Malawi has been facing different types of emergencies in form of drought, floods, storms, famine, as well as some epidemics. And these have caused a threat to life and health of our communities. And definitely they have negatively impacted on the food and nutrition security of our households, as they cause physical damage of the agriculture system, as well as the agricultural products. Excuse me. When such disasters occur, the communities, their regular services, regular practices are disrupted, and some of them are displaced, and this also affects the care for the children, and even the food systems are also disturbed. So as government, what do? We are supposed to put some frameworks that will guide the provision of services to the affected communities, and also to make sure that we'll put issues that will mitigate and also respond to the impact of the climate change. So from last year to this year, we have been reviewing the National Nutrition Policy as well as the strategic plan. After the previous policy was due for review, which was running from 2018 to 2022, and the current policy that we have revised will run from this year to around 2030. So far, we have included issues of social protection and climate change in the revised National Multi-Sector Nutrition Policy, considering the effects that Malawi has been facing over the years. And also considering that there is a special policy for social protection, we have also made sure that nutrition should also find space in the social protection policy. The revised policy has got 6 priority areas, and out of the 6 priority areas, 3 of them, they are touching issues of climate change, which also affects nutrition. In Malawi, nutrition is indeed contributing to issues of climate change. I should say that most of the households in Malawi, they depend on firewood and charcoal in terms of food preparation. So we are contributing heavily in terms of the climate change. So that is why we thought that when we are developing the policy, we should put some measures that can contribute to reduce the pressure that we are putting on the trees that we are using for preparation of our food. But to mention issues of managing problems that occur due to emergencies, we have put some strategies that needs to prevent and manage the acute malnutrition, which are caused by the emergencies that we face as the country. As a country, we faced the El Nino the previous season, as well as some cyclones. And from the surveys that we carried out, we are anticipating that we'll have increased cases of malnutrition in the first 3 months of the coming year, because this is the lean season of the country. So what have we done so far? We are conducting screening to make sure that we identify the cases area and do some referral. We are also building capacity for our health service providers, issues of provision of supplies, as well as conducting nutritional assessment and also counseling, and also linking the households that have got the malnourished children to other programs like the social protection program, because this is what we have prescribed in the policy, the National Multi-Sector Nutrition Policy, as well as the social protection policy, that we should strengthen the linkages. To talk about resilience to those affected households, we have put some strategies that will promote nutritional resilience interventions to mitigate the impact of emergencies on the nutrition status of all age groups. So how are we going to do this? We would like to advocate for inclusion of clear nutritional objectives in the resilience and also disaster risk management frameworks. So we are working hand in hand with the Department of Disaster, so that nutrition should also find its space in whatever plans the department is doing. So we have a special cluster within the Department of Disaster, known as Nutrition Cluster, which responds to issues of disaster and also nutrition. Then we would like also to integrate nutrition resilient interventions in the developmental programs that the country has established, as well as the provision of high nutritive value foods to those households that have been affected, And these are not only high nutritive value foods, but also the seeds to make sure that we mitigate the impact of the emergencies. And would also like to make sure that we promote adaptation of innovative climate resilience approaches, such as scaling up use of fuel-efficient stoves in food preparation as well as processing. Would like also to advocate the production, multiplication, and also planting of improved fruit trees around households, the community-based child care centers, around schools. Those who are living close to riverbanks, they need to plant fruit trees. We should not only be promoting the other types of trees, but the trees that will benefit from, as well as we are benefiting from the firewood, we should also benefit from the fruits that these trees produce. So the religious institutions like churches, the mosques, we will be advocating that they should have fruit trees around these places. Even the hospitals, the government institutions, we will also engage the private sector to make sure they are also buying that type of intervention. We also do some promotion of integrated sustainable natural resource management in homestead and also community to make sure that we should enrich our soils so that we can get the required nutrients that we also get from the crops they grow from that. Then we will promote the establishment of seed banks for the climate resilient and also nutritious varieties, especially the local varieties. We know that there's also need for mindset change. So we'll continue with the usual interventions of enhancing nutrition education and counseling, especially to those households that have been affected by issues of climate change. We also promote and advocate for sustainable food system as well as the climate change resilience to make sure that we improve the nutrition status of our communities. This will be done by engaging the private sectors that are involved in the food system to make sure that the food that they are producing is of good quality and good for human well-being. And also, we will promote the production of diversified and also balanced food so that people will be able to consume all the food groups that we promote as a country. We are promoting 6 food groups to make sure that their well-being is up to good standard. We also promote issues of food safety, the reduction of food waste. We know that a lot of food is wasted during ceremonies, so we have to teach our communities, to educate our communities, to make sure that they are putting on board interventions that will reduce food waste and also promote food safety. So briefly, what I can say is that Malawi has put in place the framework that will guide issues of climate, health, as well as nutrition. And what we are doing, we are working in collaboration with other sectors that are critical in nutrition and those other sectors as well. Malawi has got this department which coordinates all the sectors that implement nutrition interventions in the country. So our nutrition policy is multi-sector approach. We have got issues there for that coming from the health sector, issues from agriculture, issues from education, as well as issues from natural resources and environment. Because we understand that no single sector will be able to combat the problem of malnutrition the country is facing. So what we need to do is just to mobilize ourselves to make sure that we have adequate resources so that the interventions that we have planned to undertake in the coming years are being implemented in the right way. This is what I can share from the side of Malawi. Thank you, and over.
Thank you, Mr. Penawa, for sharing, the experience from Malawi, and both the challenges and what the government is trying to do. So it's time for question and answer. I encourage you to ask your question in the Q&A box. We have a few questions. The first question is, I think, from Philippines. Joe Rodriguez. The question is, how can countries like Philippines, where there is adverse effects of climate change, access technical assistance to strengthen integration of climate, nutrition, health policies and programs? Rachel, could you share, based on your review, any response on that?
Sure. Thank you, Habtamu, and thank you for the question, Jose. I have a couple of different answers. Probably none that will be fully satisfying, but the first that comes to mind is that I mentioned the Initiative on Climate Action and Nutrition, ICAN. ICAN sits within a global initiative that's hosted by WHO called the Alliance for Transformative Action on Climate and Health. And we could add the link to attach in the chat. It's called attach for short. Attach is meant to be a place where countries can not necessarily, draw down funded technical assistance, but at least reach out initially for technical resources, tools, experiences from other countries in who have conducted, climate vulnerability assessments, for contact with other countries who are looking to incorporate health or nutrition into their NDCs. So I would highly recommend the Attach platform and the community of practice there as a place where you could seek to connect with others. Then I would also just say that as a next step for this desk review activity from MCGL, Momentum, we are going to be putting together nothing so lofty or robust as guidance, but sort of a checklist or a cheat sheet to help direct colleagues to a number of these different resources and considerations. So look for that sometime in 2025 from Momentum Country and Global Leadership. Over.
Thank you, Rachel. Another question for Mr. Penawa is, Malawi is in the decentralization process, and to enhance national policy strategies incorporation to the district development plans, which have their own, local council priorities. The central governments are custodian national policies, and district councils are decentralized entities, have different priorities. And so how are you managing this, adaptation process and inclusion of climate nutrition into policies, considering the decentralized government system?
Thanks for that question. Indeed, Malawi is in the decentralized government, but in terms of policy formulation and development, this is done by the central government. Implementation is done by the district councils. So when they are developing the plans in the districts, they have to make reference to the policies that have been developed by the central government. So this is what happens, and we also mobilize resources from central level to support the district councils in the implementation of nutrition interventions. Thank you.
Thank you. One question in the chat box now, probably, and then Rachel can answer it. What's the next step to act on the report recommendations?
Thank you for that question. Well, as I just referenced, we will be putting together, we haven't decided what we're calling it yet, but sort of a guidance note, if you will, or a list of resources that could support countries as they seek to undertake some of this integration at a policy level. So that's one immediate next step for this team. Certainly, I would say that there is, plenty of work underway. I think the global events and moments that are coming up over the next year surely will have a host of resources, reports, guidance coming out that we could all learn from. I want to reiterate, and this again isn't answering your question so well. We'll have our own inputs from this activity, but just I want to acknowledge that this is a relatively not a new area of practice. These challenges have been with us for some time. Malnutrition has always been a challenge as at the intersection of multiple different systems and pathways. But climate change is and the effects of climate change are, an additional X factor. And so we are all learning, those of us on the health and nutrition side, colleagues on the climate science side. So, we have some good examples, and I think we need to be learning from each other and really remaining engaged. And yes, we'll look forward to sharing with all of you what we come up with next from MCGL. Over.
Thank you, Rachel. It's also, this is the purpose of this webinar, is sharing some of the timeline. So, if you are coming from a country, you can see opportunities in the NEDCs, adaptation plan, national nutrition program strategies. So you can see the timing. So I think this is an opportunity to work at country level with partners to ensure that climate is included in nutrition plan or health plans, also the vice versa into nutrition into the climate plans. So that's another purpose of sharing, the finding from this report. I don't see any other question. There are questions, I think, with regard to, whether USAID is working with FAO, the World Health Program. I think, we'll respond late, and we'll follow up with our response. Okay. So, Rebecca, can you answer on that? Or
Thanks, Habtamu. Actually, that's a great question for our colleagues in the Center for Agriculture. So I'm going to take that back to them and hopefully come here to you, and maybe we can follow up with some of these answers on the Q&A afterwards.
Sure. Thank you. So I think if there are no questions, I think, we'll close this webinar, but I'll introduce, Rebecca. It's my pleasure to introduce Rebecca Pinto, the Acting Division Chief of Nutrition Environmental Health in the Bureau of Global Health. And Rebecca has 2 years of experience designing, evaluating, managing community-based nutrition and WASH programming. She worked formerly as a chief of party for a USAID-funded pro-WASH mechanism with Save the Children. I worked with her. And also she worked as a maternal child nutrition specialist at the World Bank. And she worked in East Asia and Africa regions, and she worked in multiple countries in Philippines, Laos, Cambodia, mainly in designing and cost of integration of nutrition was related intervention. Rebecca, please give your closing remark.
Thank you, Habtamu. Thank you for that kind introduction. And thank you to you, Rachel, Koki, and the entire MCGL team. It's so exciting to see this work come to fruition, having started with just a small idea and now really expanded to so many different kinds of strategies and frameworks for possibility. After the 2022 launch of our USAID climate strategy, I think we as a team realized that in order to best support our missions, our implementing partners, it was not just going to be a question of how we pivot programming to be more climate responsive. We really had to recognize the environments in which they worked. And I think really importantly, and Rachel pointed out in her presentation, the dynamics that were at play, the power dynamics, gender and socioeconomic issues as well. And it's for that reason that I think, you know, the partnership that we've had with MCGL around this report is so incredibly important. You know, looking at the recommendations and thinking of the way forward, I'm impressed and I'm also anxious by the incredible timing of this. I think the charge is really not to just USAID as a bilateral donor, but to everybody on this call. I really feel like we are sort of partners in taking a lot of these opportunities forward, whether it's a VNA, whether it's a NAP. I really see us as sort of a global community trying to find more opportunities to integrate the critical importance of nutrition and food security into these sort of broader climate frameworks. And so with that, I want to thank you all again for joining us this morning or this afternoon, your time. I really hope this is just sort of the beginning of the journey, and that we have more information, more technical assistance, you know, even more reports to be able to share and continue this conversation. So back to you, Habtamu. Thank you very much for allowing me to be here.
Thank you, Rebecca. So I think with this great closing remark, I think we end the webinar. So, you know, I encourage you to, you know, access the report, review the report. There are, you know, so several information. Thank you, everyone, for making the opening remark, for the presentation, and closing remark. Also, thank you, the participant, for joining. Thank you, everyone.